So it's very important to understand what stem cell transplant is all about and where does it apply. The stem cells, first of all, are referring to our very young cells in our bone marrow. So our bone marrow is where we make our blood, and the stem cells are the youngest cells. They're like the mother cells. They can produce all the cells that become our blood cells. Now, why do we use that? Because we are treating some diseases where, some of these blood cancers, where we need to give a chemotherapy treatment, which is going to be given at a high dose for that type of chemotherapy. And that's actually going to achieve a long remission or a cure in some diseases. And the reason we can do that safely is because people can tolerate that fairly well, but it would suppress our normal bone marrow from making our normal blood counts for a very long time. And so that's not safe. So we're able to collect in advance of the chemotherapy these stem cells. And we actually don't have to go to the bone marrow inside our bones where they live, but we can get them to circulate. We call that mobilization. We can move them into the blood. And like a blood donor, we can collect these stem cells and then we store them away when we have enough. And then the patient gets their high-dose chemotherapy, and a couple of days later we give them back their own stem cells. It's just a transfusion into their bloodstream. They know how to get home, and then we give them a little stimulation, a little natural growth factor to get them going. And instead of the blood counts being low for weeks or months, it's about a week of time that we just have to support our patients through this low blood count phase, which makes it very safe. So that's the principle of what we're doing.